The views or opinions expressed on Ann Arbor Inclusive do not necessarily reflect the views or opinions of the City of Ann Arbor and the Commission on Disability Issues. For more information about the Ann Arbor Commission on Disability Issues, please visit a2gov.org/disability resources.
Hello everyone and welcome to Ann Arbor Inclusive. I'm Zach Damon. We have a wonderful show for you today as Joyce Patterson, diabetes educator at the Adult Diabetes Program with the University of Michigan, joins us in studio. And Joyce, let's get the ball rolling here. So first of all, why diabetes for you?
Why diabetes? Diabetes is a very important topic to me. I actually lost my father to diabetes about 20 years ago, and at that time my father was very sick. He had a lot of all the complications you hear about with diabetes. He had them all. He had lost his vision. He had a quadruple bypass. He had had end-stage renal disease. And quite frankly, at the time, I really just thought that he was dealt a bad hand. I had no idea until maybe 10, 15 years later when I started studying nutrition that all of that was very much related to his type 2 diabetes.
Sure.
And once I learned that, it really made clear to me how important it is to manage diabetes. So today, as a diabetes educator, I am very honored to be able to share this information that we didn't have when I was younger, when my father was sick. So.
Right. I mean, you bring up a great point that a lot of information that is available now, wasn't available then. And I mean, I feel like as far as the medical sciences are concerned, we are in probably one of the best times to be alive because there's so much innovation coming through in diabetes research, medical research, and it really is an amazing time. And just an amazing story with your father. I mean, I'm curious, for our viewers, I mean, how much of pre-diabetes and diabetic tendencies within the body or within nutrition, I mean, how much of that is hereditary, and how much of that is brought on, of course, by your lifestyle and your activity?
That's a great question. Type 2 diabetes, the risks are multifaceted for sure. There are certainly genetic dispositions. There's certainly family history plays a role. Certain ethnicities are at higher risk. Some medications, if you're treating certain other conditions, that could increase your insulin resistance. So there are a lot of factors that aren't as much in our control. And then there are the factors that we do have more management over: how we eat, how physically active we are, how we manage our weight.
Sure.
So quite a number of things contribute to someone's risk for diabetes.
And it's very interesting because you talked about type 2 just now, but many of us have heard the name diabetes, and we've heard the terms, spoken. Oh, I have type 1 or type 2, or I've gotten tested for this and tested for that. But I'm curious, and I'm sure some of our viewers are as well, what is the differences between type 1 diabetes and type 2?
Absolutely.
Would you mind describing?
Absolutely. So type 1 diabetes is an autoimmune disease. So that's basically where the body's own immune system is producing antibodies that attack the cells on the pancreas that produce insulin. And it attacks the cells to the point where your body is unable to produce its own insulin. So people with type 1 diabetes are insulin dependent.
Okay.
With type 2 diabetes, the difference is that it's often characterized by starting off with some insulin resistance.
Okay.
And that insulin resistance can eventually progress to insulin insufficiency, and that someone with type 2 diabetes can also end up needing insulin because they're not producing enough insulin as well. Some misconceptions is that someone with type 2 diabetes, if they progress to needing insulin, sometimes I hear people say, oh, I'm type 1 now, and that's not the case. There's still no autoimmune component to type 2 diabetes. So that's the difference.
Sure. No, thank you so much, because there are a lot of misconceptions. And, another misconception, too, and you and I talked a little bit about this before the show, and I thought it was pretty fascinating. You told me, Zach, there really is no diabetes diet per se.
Right.
Now, why do people think that there is that diabetes diet, and what is a misconception with that? Why do you think people have that misconception?
So when it comes to our blood sugar, obviously the foods that we eat are going to directly impact that.
Yes.
And so I think there is this misconception that there's a specific diet that can help with that. But the reality is that all the same recommendations for healthy, balanced nutrition apply in someone with diabetes, type 1 or type 2, as applies to the general population. It's still about balanced nutrition, portion control, and making sure you're getting enough vitamins, minerals, fiber, protein, and that balance.
Sure.
The problem in diabetes is not that there's a change in your need for vitamins or minerals or carbohydrates for that matter. The difference is how the body processes it. So, for me, I still need as many vitamins, minerals, and carbohydrates as, say, someone just like me who has diabetes. The difference is in how my body is able to process it.
Got it.
And so for someone with diabetes, that would include some support from medication, as well as being very mindful about balanced meal planning and physical activity and maintaining a healthy weight.
Well, no, and I think all of those are tremendously important points. I think it's important for people to really be mindful of the signs in their body, be in tune with that, and like you said, be in tune that what you put in your body is extremely important.
Absolutely.
Yeah, and it's interesting because we spoke before the show, and you mentioned a philosophy to me that I thought was great and also very fascinating. And you believe in the philosophy that nutrition works. And can you explain what that means and why you feel that's important?
So I think what's very interesting about nutrition is that for most people, we can't sense right away what's happening to our body when we're processing a meal.
Sure.
For someone who has food allergies or food intolerances, or someone with diabetes who's checking their blood sugar, they get a much more immediate response on how foods affect their body.
Right.
So if someone is trying to make nutrition changes because they have high cholesterol, they might not necessarily have symptoms of high cholesterol, so it's a lot harder sometimes to make these lifestyle changes when you're not getting that immediate feedback.
Sure.
But for people who have a more immediate response to the foods that they eat, the effects and the benefits of the nutrition changes one makes is much more clear. So someone with, whether it's food allergies or type 2 diabetes or type 1 diabetes, can see immediately the changes depending on the foods that they eat.
Wow.
So nutrition does work, but not everybody has the benefit of seeing how it does work.
Sure, and that is so fascinating. So fascinating. And speaking of nutrition works and speaking of pre-diabetes, we have a very wonderful video that talks about the pre-diabetes testing. So let's take a look.
Baby Goat Disco, a perfect way to spend a minute. So is taking a 1-minute pre-diabetes risk test. 84 million Americans have pre-diabetes. You might be one. So let's do the test. Count on your fingers. Are you a man? That's 1 point. Family history of diabetes? 1 point. High blood pressure? 1 point. Inactive? 1 point. Are you over the age of 60? 3 points. 50? 2 points. 40? 1 point. Are you overweight? Very? 3 points. Moderately? 2 points. Somewhat? 1 point. Now, is your score 5 or more? Then you likely have pre-diabetes, but it can often be reversed. So talk to your doctor. And now, a closing word. Take the risk test. Do IHavePrediabetes.org.
What a funny video.
Isn't that
My
cute?
goodness, that is so cute.
Super cute.
My goodness. Well, it also really brings up a great point. When I was looking at, the points system, I found myself adding up my own points. I go, gee, do I have this? Okay, that's what.
I hope
do
you
have
scored
this?
well.
Yeah, no. And I mean, luckily I did just fine. But it's really an informative video, and it really catches your attention and really helps you understand. I mean, it said 84 million Americans have prediabetes. 84 million, that's a huge number.
Yep.
Huge number. I mean, do you see people becoming more aware of the pre-diabetes symptoms and them, taking steps to reduce that?
Oh, definitely. At the university or at Michigan Medicine, we have the diabetes prevention program, and that program has been growing. And people are concerned when their doctor tells them that they're in the prediabetes range, and it is very motivating. Like, I think most health concerns, that sometimes often is the impetus for people to start making change.
Yeah.
So, but we do see quite a bit of progress in the program, and many people have come back and said that their blood sugar management has improved, and even, as shown in the video, can be reversed.
Yeah. Wow. And I mean, so to you, in your mind, as someone that deals with this on a daily basis, what do you find to be the most common cause of prediabetes?
Obesity,
Yeah.
definitely. I mean, as we know, the obesity rate in our country
Sure.
has been growing significantly. I think we're maybe around 34% of the nation is obese, and around 67% is overweight.
Wow.
And concurrently, we see an increase in the rate of prediabetes and diabetes. So
Yeah.
there is definitely a direct link, which I think is what makes prediabetes something that can be addressed and
Right.
can be reversed.
Yeah, of course,
sure.
of course.
Yeah.
Well, and it goes back to the point you brought up earlier of nutrition works. Really understanding how important your diet is, what you're putting in your body, but then, of course, incorporating physical activity with that.
Absolutely.
In your mind, I'm really curious,
Yeah.
how important is nutrition works within the disability community?
Well, I think it's important to everybody. We all eat. For all the medications and technology in the world, at the end of the day, we all eat.
Yeah.
So, I think what I find is there's a lot of acceptance in how medications work.
Right.
To either manage symptoms or lower risk for certain diseases.
Right.
And many times we take medications with a lot of faith, but I think often we disregard the same reactions that our bodies make when we're putting something in our mouth in the form of food. We
Right.
take a medication and we know there's going to be a chemical reaction that's going to help us.
Right.
And we forget that when we eat food, there is also a chemical reaction that may help or hurt us.
Right.
So nutrition is important for everybody.
Right.
Yeah.
Well, and I think it's important to note too, again, back to that physical activity as
Yeah.
well as nutrition.
Yeah.
Even those that, are in wheelchairs, they should have the opportunity to go to a gym and work out as well as worry about their diet.
Absolutely.
And make that choice, right?
Absolutely.
To if they have the pre-diabetic symptoms, to get rid of that.
Yes.
Have you dealt with people, with disabilities in your diabetes education, and
Yes.
have you talked to them about that?
Oh, absolutely. Physical activity is a major component in managing blood sugar, preventing diabetes, managing weight, managing all sorts of conditions, your blood pressure, your cholesterol.
Sure.
All of that can improve with physical activity. And fortunately, there are a lot of resources in our community that increase accessible to physical activity. So we do try to make our patients aware of what those resources are,
Yeah.
whether it's free online videos to resources available around Michigan medicine, to resources available in our community in general for modified exercise programs that working with exercise professionals that can address whatever limitations someone might have.
Yeah.
Absolutely.
No,
They're there.
Yeah, no, and I think
Yeah.
that's wonderful, Joyce. And it's interesting too, because the U of M diabetes prevention program has been shown to cut diabetes risk in half and is soon to be covered by Medicare in April of 2018.
Yeah.
But can you tell me, why is the University of Michigan diabetes prevention program, why are they the leaders and best?
Oh, one of the differences in the Michigan Medicine Diabetes Prevention Program is that we do use registered dietitian nutritionists and diabetes educators as facilitators.
Oh, you do?
Now, having said that, the Diabetes Prevention Program was designed so that it can be easily accessible and delivered using non-healthcare professionals.
Sure.
And overall, the program has been shown to be very effective, but there is some benefit to having that year-long contact with a registered dietitian, because people with prediabetes often may have other health conditions, high cholesterol, high triglycerides, high blood pressure,
Sure.
And as well as any other nutrition conditions that do exist, whether it's food allergies or restrictions or things like that. So when you have registered dietitian nutritionist leading the program, they are able to accommodate those other needs and concerns as well.
No, and I think that's amazing. And because you are, with the University of Michigan and that wonderful diabetes prevention program, is it just for, adults, or do you offer it to students? How does that work?
So the eligibility for the diabetes prevention program is for ages 18 and up. And you do have to have a diagnosis of prediabetes.
Sure.
And in which case we're looking at your A1C level.
Sure.
A recent lab draw that shows that your A1C level is between 5.7 and 6.4%.
Okay.
And then as well as a weight eligibility. So your BMI has to be over 24 or 25 down the line.
Okay.
Yeah.
And for those that don't know what BMI is, it's body mass
Yes,
index,
thank
right?
you. Yes.
Yeah.
Yeah.
Right. And so that's the percentage of fat, right, to your body weight?
It's the ratio of your weight for your height.
Oh, got it.
Yeah.
Weight to height.
Yeah.
Okay, there
so
we go.
sometimes it can be a misleading measurement, but it's in general a good gauge for whether or not you are overweight.
Sure, sure. Now, for those that don't know, what are some symptoms of prediabetes?
So some symptoms of prediabetes, there may be none, to tell you
really?
the truth. It could
Wow.
just be that you are going for your annual exam and then you have your annual blood draw and then you find out your A1C is elevated. But for some might report that they've been feeling more tired lately, and that's part of the insulin resistance and the body's inability to break down sugars and use them for energy.
I see.
When people's blood sugar is higher, they may be experiencing more thirst,
Okay.
more frequent urination. So, and again, just overall symptoms of fatigue.
Sure.
So those would be symptoms I would often hear about.
Sure. So would you encourage those in any case to, get that checked and make sure, that their levels are okay?
Absolutely. And again, refer to that 1-minute test. It's an easy test. Just refer to that video and see if you are at high risk.
Well, yeah, and see some cute goats while
And
you're at
see
it.
cute goats. Yeah, absolutely. Yeah.
No, that's wonderful. I mean, and then also, I'm interested too. You had mentioned that you've been in the city of Ann Arbor and in the Ann Arbor community for a long time.
Yeah.
What is it about Ann Arbor that you really love and enjoy?
I love that Ann Arbor has such a progressive and worldly feel, but yet it is nestled in this little small town feeling. Like, earlier we were just talking about other people in the community, and I said, oh, I know that person. And and then, we've got this kind of nice college town feel, but then we're surrounded by all sorts of nature areas and, beautiful countryside. So it's I think one of the most perfect little towns to live in. Yeah.
Now, as a diabetes educator, when you go home at night, is it hard to shut it off sometimes?
All the time.
Yeah.
All the time. I don't turn it off.
No?
Not with every meal that I plan for myself and when I'm talking to my family. And I'm not saying that I'm 100% doing the right things, but I'm always highlighting when I'm not. Let's put it that way.
Yeah. I mean, but a nice scoop of ice cream isn't bad every now and then.
Oh, absolutely. So, and I think that that's important too. Remember, when it comes to type 1 diabetes, type 2 diabetes, it's not that these foods are in and of themselves harmful to us.
Sure.
It is that our body is unable to break them down the way you would be without diabetes.
Right.
So for anybody, having a daily scoop of ice cream, that could add up in calories over time. I wouldn't recommend it to someone with diabetes or someone without diabetes. So it's just a matter of, again, the same concepts of healthy living or healthy eating apply.
Right.
Portion control, how frequently are you indulging in things, and ideally there are things that you're having more often that are good for you and things that you are limiting.
Right. Yeah. Well, and really quickly too, I'm very fascinated, and I wanted to know your opinion on this. But Michigan, we're a very big craft beer state, right? We love our nice craft beer.
Yeah.
But what do you have to say to those that just love the stuff, but could be at risk for prediabetes?
Could be, in and of itself, alcohol in moderate consumption has been shown to have some protective effects.
Sure.
But you really got to think about how much.
Right.
In terms of binge drinking, that increases your risk for heart disease
Yep.
and other health conditions. From a calorie standpoint, you could just be getting a lot of excess calories depending on how much that you drink. So I think again that goes to the balance that we were talking about
Sure.
earlier. It's
Yep.
about the frequency and
Yep.
the portion, right? But for somebody with type 1 diabetes or someone with type 2 diabetes on insulin or type 2 diabetes on some other medication that might increase your risk for low blood sugar, alcohol can be dangerous, especially in excess, because
Okay.
it could actually increase your risk for severely low blood sugars, which
Oh,
can
wow.
be very dangerous.
Really?
So oftentimes people with diabetes are wondering how many carbs are in a beer, or how many carbs is in wine, or how many carbs is in a mixed drink.
Mm-hmm.
And while yes, carbs are what cause blood sugar to go up, in terms of alcohol, the risk for low blood sugar is actually much more dangerous than the effect of the carbs on blood sugar. I will say is that the general recommendation is that a drink per day for women or 2 drinks per day for men is generally considered as safe, and
Okay.
again may have some health benefits.
Perfect. And of course, I wasn't referencing yourself because, we know that you're very responsible, but I just meant, for the wonderful community, because we are a community that likes to have a good time.
Sure.
And we are a community that, loves our athletic teams and likes to be able to
Absolutely.
support them and have a wonderful social atmosphere around there. So, of course, was just wondering.
Yeah,
And,
yeah.
But Joyce, I definitely really appreciate you being on the show. I know hopefully the community of Ann Arbor does as well. And of course, if anybody has any questions about, the U of M diabetes prevention program,
Yeah.
how can they get in touch with you or get in touch with your department?
Yeah, so they can give us a call at 734-998-2475, select option 1. And you can ask for Joyce.
Okay.
Or you can send an email to um-mend-dpp@med.umich.edu. It's a long one.
Yeah.
Sorry.
Well, no, and hopefully the folks can see it at home and be
Yeah.
able to contact you, and if they have any questions, definitely. So
Absolutely.
thank you so much, Joyce, for your time, and we really appreciate it. And folks, that's all the time we have for today. But I'd like to thank Joyce for joining us, and hope that you enjoyed the program. And please be sure to tune into Ann Arbor Inclusive next month. And as always, stay awesome, Ann Arbor.